All right. Welcome everyone to our webinar on creating a community health needs assessment. We're super excited to have you here today. We have some great presenters lined up, so I'm really excited to get started. So we have Cara Gamble. She specializes in grant writing, strategic plans, needs assessments, lookalike, FQHCs, and 340B program implementation for Burrows Consulting. She's an alumnus of Union High School and received her undergraduate degree from Indiana University School of Medicine in Health Services Management through the accelerated program. She went on to receive her master's degree in health administration, graduating with honors. She worked for the Indiana Department of Workforce Development in the Department of Occupational Employment Statistics before returning to rural Indiana. Cara began working for Greene County Health in 2015, where she helped achieve federally qualified health center lookalike status and implemented a successful 340B program with these three contract pharmacies. She served in multiple roles at GCH, including project manager, interim CEO, and director of strategic planning and development. Throughout her time at GCH, she secured over $430,000 in grant funding. She has participated in a number of successful on-site visits and has written numerous HRSA-approved needs assessments and strategic plans. She is certified in Lean Sigma 6 and is a HRSA grant reviewer. In her free time, Cara enjoys reading, outdoor sports, and spending time with her husband and their 3 children. Deborah Branson earned her degree in English from Rockford University, where she graduated summa cum laude. Upon graduating, the university hired her to establish its first grant development program. In the next 3 years, she brought in several $1 million from the university for state, national, and federal funding sources, with a 90% success rate. As a member of the Association of Fundraising Professionals, she developed a network of connections with nonprofit organizations throughout Northern Illinois, and her reputation for success spread. She began working as a consultant in grant writing and fundraising for many of them. She has worked as a consultant for nonprofits in nearly all fields, from the arts to healthcare to social services, helping to garner grant funding for capital, program, and operating needs. One of those nonprofits was a community health center serving several counties in Northern Illinois. Through this connection, she met John Frana, which launched a productive working relationship of more than 25 years with the Frana Group. She is thrilled to now be a part of the Burrows Consulting team after its merger with the Frana Group and looks forward to contributing to its ongoing success. She specializes in needs assessments for lookalikes, federally qualified health centers, and also writes grants for her local animal shelter. She lives in Lawrenceburg, Kentucky with her husband and her feisty Vizsla, Sophia. She enjoys spending time with her children, grandchildren, gardening, kayaking, reading, and oil painting. I'm super excited to have these 2 ladies here. As you heard in their bios, they specialize in needs assessments and have a large, expansive experience in needs assessments. So I'll turn that over to them and hear what they have to say today.
Hi, everyone. So we're just going to start out by giving you a general overview of community health needs assessments. So also known as a CHNA or even a CHA. It is a state, tribal, local, or territorial health assessment that identifies key health needs and issues throughout data collection and analysis. HRSA defines needs assessment for health centers in Chapter 3 of the Health Center Compliance Manual. Throughout the data collection, you can do primary or secondary. I usually suggest doing both just to give you a better picture of the service area overall and a more comprehensive assessment. The requirements of a CHNA include, first of all, defining the community or the service area. So where are you looking at? Are you looking at a state? Are you looking at a county? Are you looking at a specific region? It's very important to specifically define that service area. You're then going to define your target population. Are you looking at the entire population within the defined service area? Or are you actually going to look at a subset of the population? For example, perhaps you are specifically looking at children within the service area or mothers, infants, and children within the service area. Maybe you're looking at substance use disorder. So you're looking at those who might be diagnosed with SUD within that region. You're then going to define the why. Why are you conducting the assessment? Are you doing it for a specific grant funding opportunity? Therefore, look at the requirements of that. Is there opportunity for maybe maternal health? Are you doing an exploratory needs assessment, just looking at the general population in the community and what needs they may have? Maybe you are targeting it to an issue that you believe is occurring within the area. Maybe you think diabetes, heart disease is an issue, and you're looking at that and taking a closer look. Your requirements are going to be determined by your why. So when you answer your why, you will know your requirements and why you're actually going to conduct that and what you're looking at specifically. For an exploratory needs assessment, you are doing this to determine the needs of the target population in your defined service area. You're going to determine what healthcare services are needed most by that defined community. You're going to explore the needs surrounding specific populations or maybe even a specific health concern. Again, maybe you are concerned about how substance use disorder or opioid use disorder is impacting the population. And so you're going to look up data related specifically to that. You're then going to identify needs through data and feedback that may otherwise be unknown. For example, perhaps you are just doing an exploratory one and you don't know what you're looking for. You just want to find out what healthcare needs the community have. The use of focus groups can really be helpful in this. And through those defined focus groups, often what we see in our experience is that they bring feedback to you about healthcare needs that you might not be aware are occurring within this community. So that can be really helpful in identifying issues that you don't know are actually issues. Okay. Another reason to conduct a CHNA would be to find specific community needs in order to seek specific funding opportunities. So the identification of a public health concern and needs surrounding that concern allow you to be able to search for funding opportunities to benefit the community so that a good fit can be identified and specific types of funding can be sought after. For instance, you find out your needs surrounding diabetes and that you really maybe have a need surrounding nutrition, dietitians for that population. You can seek grant funding specifically related to diabetes management, diet, nutrition. All of those can be specifically then sought out. And you already know by your CHNA that you have a good fit for that. And you have the data already available so that you are able to tailor it for that grant funding opportunity.
Hi, this is Deborah talking, everyone. In a needs assessment, so, you know, what do you need to include? What is HRSA looking for? In terms of the barriers to care and the need in your service area, they're wanting to know exactly how well you understand the barriers to care and the need. And they also want to know, in terms of the special population, what barriers to care and need they have. Even if you don't focus on or receive funding for those special populations, which are the people experiencing homelessness, the migratory agricultural workers, and the public housing residents. So you're going to try to describe all the barriers to care and the need in your service area. And also in the needs assessment, you're trying to show how well you understand those barriers to care and the need among the service area and the target populations. So for the HRSA components, HRSA requires a needs assessment to be conducted at least every 3 years for FQHCs and lookalikes. And for the 3-year assessment, you must address access to care and healthcare utilization. And what they're looking for in this category is the geography, transportation, occupation and income levels, transients, unemployment, and educational attainment among the service area population. The next thing they're looking for are the most significant causes of morbidity and mortality and any associated health disparities associated with those. Typically, the causes of morbidity and mortality that they're looking for you to provide more information in depth on are diabetes, cardiovascular disease, cancer, low birth weight, and behavior health. And they're also looking to see racial and ethnic disparities in particular among these diseases. And then the last option that they offer is other unique health care or needs characteristics impacting the health status or the access to or utilization of primary care in your service area. And these are typically things that you can identify that you found that are relevant and that have particular impact on the ability to access and use healthcare in the service area. And these would include language, such as English as a second language among the service area population, the culture and belief systems, and the housing status of the service area population. And we'll talk a little bit more about those on the next slide. So the community health needs assessment topics that HRSA is particularly concerned about fall into about 4 different categories. The social determinants of health, anything that impacts healthcare in terms of geography and the physical environment. And these include not just the natural features of your service area, but also the condition of roadways, the lack of sidewalks, the walkability of the service area. I look at usually heavily trafficked interstate or state routes that run through the service area, any railroad crossings or railroad hubs that are there, the rural isolation of the area, if it's not considered an urban area, any access to outdoor recreation areas, parks, and fitness centers, and then the school districts that serve your service area, along with the availability of social services. And then under transportation, they want to know the availability of public transportation. You can look a bit at rideshare abilities. And then I always look at the social service agencies and organizations that are offering transportation to and from medical appointments. Most of the time it's only for the clients of those social service agencies. Educational attainment is another social determinant of health, and that includes the population that has a high school diploma or equivalency, graduation rates, the population with a bachelor's degree. And I also look at, in more recent years, I've looked at the 4th grade reading level, because what they're finding is that the ability to read at or above reading level at the 4th grade, in particular, Annie E. Casey Foundation has done some research into this, really foretells the success or lack of success among the students for graduation rates, for their academic success, and it follows them on into adulthood. So that 4th grade reading level they're finding is a significant factor. Language, this has to do with whether or not a different language is spoken at home, the rates among the service area population, and what those languages are. One other thing to look at is the ability for your community health center to provide translation services if there's significant need for English as a second language translation. And then cultural or ethnic factors. These really have to do with some of the beliefs that many of the races and ethnicities bring along with them from a lot of times from the old country if they come here as immigrants. Some of these are a reliance on traditional healing, the reluctance of foreign and in particular undocumented workers to seek healthcare, and collectivist values in which people rely on families and friends for opinions on accessing healthcare and what kind of treatments to use. The last kind of social determinant that I take a look at are the at-risk populations. And for these, we're looking at individuals who are less than a year old or over 65. Those are pretty much our higher at-risk populations for many of the disease and health issues. People living with a disability, veterans, people experiencing homelessness or housing instability, and the migratory agricultural workers. And in terms of economic factors, you're going to look at the rate of people that are uninsured, the rate of people that are publicly insured in your service area, occupation and income levels. And generally, we're looking at the federal poverty guidelines at the 50%, 100%, 200% levels. Transients, again, these are individuals experiencing homelessness and migratory agricultural workers. Unemployment rates, you can find those through the Bureau of Labor Statistics. Generally, that lags maybe about a month or 6 weeks before the new figures are released. Food and housing insecurity. You're looking for, are there food deserts in your service area where there's a lack of grocery stores, a lack of fresh foods, lack of farmers markets, those kinds of things. In terms of housing insecurity, you're looking at people who pay 30% or more of their monthly income for housing. So those are considered housing cost burdened households. Financial strain, there are a myriad of ways to look at that. And again, that goes hand in hand with housing insecurity, food insecurity, occupation, income levels, those kinds of things. These last two, intimate partner violence and human trafficking, have been something that HRSA has added, I've noticed in just like the last few years. They're looking at rates of people experiencing intimate partner violence, rates of human trafficking in terms of sex trafficking and labor trafficking. Those can be statistics that can become somewhat difficult to find because they are underreported, and we'll talk a little bit more about those on another slide. Health indicators. Morbidity and mortality rates, and some of the more common diseases and syndromes that they're looking for are infant mortality rates, diabetes, coronary heart disease, asthma, cancer, low birth weight, substance use disorder, and then other health indicators that you may find as you're doing your research and looking at different diseases and morbidity and mortality rates that you find that are quite high in the service area compared to state and national rates. And then just in general for the area and population served, they're looking at overall demographics, race, ethnicity, age, those kinds of things. And then the ratio, they're looking for the degree to which there are shortages in terms of providers, the ratio of primary care providers to the population, the ratio of behavioral health providers to the population, and the ratio of dentists to the population. They're looking at uninsured rates, Medicare beneficiaries, penetration rates. And this is something that your UDS MAPR report will indicate the rate of penetration in terms of a healthcare program serving the uninsured, Medicaid, public insurance beneficiaries, and people that are in the low income range. And then medically underserved areas, medically underserved populations, and health professional shortage areas. And just a note, the economic factors, the social determinants of health, and the health indicators should always be compared to state and national rates. Provide a context for the depth and the breadth of your need. If we just put a percentage out there, the reader will not maybe realize, whether that's significant, is that high compared to what's happening at the state or the national level. And then I always try to look and see and analyze those kinds of topics for racial and ethnic disparities. So often the racial and ethnic minorities carry a much higher burden of disease. They have more challenges in terms of barriers to care, and they have lower utilization rates. So what data should I use? Well, as Cara has said, primary data is always the best. And she, as I recommend as well, a combination of primary and secondary data. The primary data is going to be data you collect through as Cara has said, surveys, focus groups, in-depth interviews, town hall type meetings. It provides data at the granular level, directly from the population you serve, directly from the horse's mouth, so to speak. And this can be a great way to involve your board and other volunteers in the process, to lead the focus groups, perform some interviews, lead a town hall meeting, promote completion of the surveys. This oftentimes, as Cara said, you may use a consultant to conduct this because it can be time consuming, very in-depth, and difficult to analyze the data that comes back. In terms of secondary data, this is data that's not collected by you. The best sources for secondary data will be the federal, other public health agencies like U.S. Census, the CDC, the National Institutes of Health. HRSA has a variety of data available on their website. And then also academic research centers are excellent sources. The county health rankings and roadmaps from the University of Wisconsin Public Health Institute, or the Institute for Health Metrics and Evaluation at the University of Washington School of Medicine are two that are really top notch. Just be sure when you're using secondary data that you're using the most recently available data. Much of it can be found online, but if not, I've been pleasantly surprised by the number of times when I've tracked down an email address or a phone number for a person that I thought could help me and contacted them directly. You're going to share who you are, who you work with, what data you need, why you need that data, how the data will be used, when you need to have the data returned to you by, because I found that helpful to have kind of a deadline. And then always thank them for any help they can provide. And if they can't help you, I always ask if they could point me in the direction of the person that could possibly help me. So on this page, I just listed many of the data sources that I've found helpful that I use. Again, UDS Mapper, US Census Bureau, the most recent 5-year survey now covers 2017 through 2021. And one point I did want to make is always cite your data sources in your needs assessment. The reader will want to know the credentials and the reliability of the data that you're using. You have the MUA-MUP HPSA searches on HRSA's website, a very user-friendly, easy to use website. The PIT counts, I'm not sure if everyone's familiar with those, the point in time counts that are normally conducted nationwide in January every year of the individuals experiencing homelessness in communities across the country. State education agencies. These have been very helpful to me because they normally track the students who are experiencing homelessness, the public school enrolled students who are experiencing homelessness. And many times you'll be surprised at how much higher those numbers are than the numbers that were collected during the PIT counts. The education agency will also help you with graduation rates. And again, if you can't find that 4th grade level reading, they'll have it usually buried somewhere in all of their reports. Kaiser Family Foundation, I'm not going to go through all of these. One other point that I want to make in particular is the other state agencies. I've contacted the Child and Protective Services agencies who have been helpful to me in terms of relating the percentage of of children who have been removed from a home due to substance use disorder. And again, that shows, you know, a need there. The Attorney General's office of each state has been helpful in providing data concerning human trafficking and intimate partner violence. And the Department of Transportation at the state level, they often have a strategic plan that outlines and indicates areas where there are significant need for upgrades or significant issues with transportation. And normally you can do a search on those by county. The local hospitals are a good secondary source of data if they're including any of your service area in their community health needs assessment, and they must share their assessment widely. It has to be done every 3 years, and oftentimes they post it to their website. And so one last thing is Google it. If you can't, you know, find it with any of these sources, Google it, but do make sure that your data source is credible and that it's up to date. And then if you're, you know, thinking of conducting your own community health needs assessment, these are a few of the sources that have tremendous resources and information online. The National Association of Community Health Centers, you're probably already aware of that. Your state primary care association, oftentimes they'll hold workshops about conducting a CHNA. And the Kansas University Community Toolbox has an extensive workbook that can really be helpful. And then just the last, you know, piece of advice that I have, and I'm sure Cara has others to share with you, is just always interpret the data for the reader. I think I mentioned that earlier. Don't just type the numbers into a table and leave it up to the reader to determine if it's relevant or if it shows significant need. I always include a paragraph where I talk about what percentage it exceeds or lags the state or national rates. So just be sure to do that. Tell the reader why it's relevant, how much it lags or exceeds the rates, and the impact it has on the ability of people in your service area to access or utilize care, or the impact on their health outcomes.
Cara, do you want to jump in here with any advice from you?
I think we covered a lot of it, and I don't want to spend too much time so we can have questions. But again, I just think reiterating what Deborah says, make sure you tell your story. You are telling a story with your data. Don't just provide them a lot of data. Tell them why it's important, why it matters. That's why a lot of times it's great to specifically look at and make sure you have a story so you can seek out specific grant opportunities. You know, you have a horrible infant mortality rate or a very high teen pregnancy rate, and then you can find opportunities that best fit you, because that's how you're going to be able to best tell your story.
Great. Thank you both so much for that. That leads us right up into our Q&A session. So thank you, Deb and Cara, for all of the great information you added there. That was very insightful. And I think from what I've heard in the comments, going to be very helpful for a lot of organizations. I wanted to turn it over to the Q&A session. We had a few submitted during registration, but if you have more questions that popped up throughout this session, please put them in the chat and we'll get those answered for you today. But the first question is for either of you, do you have any tips of ways to get community health needs assessments more standardized? Feel free, either of you, to answer.
Deborah, unless you would like to answer, I will just say, I just want to clarify that, you know, on more standardized, I'm not exactly sure what it's asking, but really you can't standardize them if there's for a specific funding opportunity, because you want to write and meet the needs of the needs section of the funding opportunity. So you do have to address all the questions. I would say if you're a health center or a lookalike, I would suggest when you update your needs assessment every 3 years to look at the newest lookalike standards, the newest new access point standards you can find. I know those aren't released every year, so I typically look at the lookalike and look at the new access point, and I base a needs assessment based off what they are asking, what they are currently requiring. So that way, if a new access point comes out, you are prepared for that, and you know you are meeting HRSA's requirements there.
Yeah, I think that, you know, that's the best advice you can give. I think, you know, each funder has, you know, certain criteria and that they're looking at. And you just need to follow, you know, what the funder wants to know about your service area. So I don't see a way that you could come up with any kind of standardized needs assessment. Every area is so different.
Great, thank you. The second question is, we kind of touched on this at the beginning, if you want to go over it again, why are needs assessments the most important part of federal applications? Either of you feel free to take that.
Here, I think you can go ahead and address that. You did it so well initially.
Okay, so why are they often the most important? Because it's going to tell your story, okay? In any funding opportunity, your needs section is where you're making your case for that funding opportunity. So you are telling them why you need funded, what is going on in your community. Your diabetes rates are high, your childhood obesity is high. You know, you're looking at that. Again, like I mentioned, if it's a maternal, you're really going to discuss at length your infant mortality rate. You're basically justifying why you are a good fit for the funding opportunity, why you are a good fit to become a lookalike. You're showing your, you know, or a new health center grantee. You're showing your poverty rate. You're showing the need in your community, your social determinative health that's impacting the population, racial and ethnic factors in there. I think Deborah did a great job on, you know, that looking at that and how they are impacted. Perhaps different groups are impacted by heart disease or diabetes or even maternal rates. So you're really telling your why. So not to kill that, but that's what you're doing, is you're telling your story.
Mm-hmm. Yeah, and
Great.
I think you're emphasizing the need. You know, obviously the funding source wants to put their money where they're going to meet the greatest need. So you know, it's just critical to be able to emphasize the depth and the breadth of the need in your area.
Absolutely, thank you. Final question that's we've had in come in so far. Again, if you have more, please put them in the chat. On the screen is also a QR code to our website and Cara and Deborah's contact information. But last question, unless we have any more roll in, are what are the roles or titles of professionals within a healthcare organization that normally would work together to create or revise a community health needs assessment? Essentially, who is tasked with that this responsibility normally in your experience?
Well, I think, you know, it just kind of depends on the organization. Oftentimes, you know, we've talked about this previously, that oftentimes it's, you know, the executive administrative team, you know, the CEO, the medical director. Oftentimes you'll find the quality assurance, quality improvement team is heading that up or is a part of that. But again, you know, in my experience, it just kind of depends on the size of the organization and, you know, how the roles are divvied up. Oftentimes the board might be involved in at least a portion of it. Cara, do you have anything to add?
Yes, sometimes they might have, depending on the size again, an in-house grant writer. Others may contract out that service. I know we are often contracted for that service here at Burrows Consulting. And sometimes it's an executive assistant. Sometimes it is, you know, a public health specialist or analyst adding in that data. It really just looks different depending on the makeup of the organization.
Definitely would agree. So that wraps up our Q&A session. Deborah or Cara, if you have any last comments, words, or all of our attendees, thank you for joining. If you have any last minute questions, feel free to add them in the chat. If not, you can go ahead and either visit our website, you can contact Cara or Deb if you have any follow-up questions. This will be recorded and sent out tomorrow, so feel free to share this if you've had some ideas, maybe want to share this with your leadership team. We will send this out tomorrow, so you have access to that. But thank you everyone for joining, especially thank you Cara and Deborah for presenting today. I hope you all found something insightful, and I hope you guys all have a great weekend. Thank you.
Thank you.
Thanks.